I have gathered my supplies, an IV start kit, 22 gauge IV needle, pre-filled saline syringe, extension tubing, and gloves. I'm sorry for this angle. I will now be entering the patient's room. Hello there, Mr. Leaf. This is Joseph Grantham. I'm going to be your nurse today, and I need to insert an IV catheter into your forearm here. Is that all right? Oh, yes, sir, but what's it for? Well, this is going to be a catheter that's inserted into your vein, so that way we can administer any medications that you need or any fluids. Oh, that sounds just all right. I'm donning gloves. Now first I need to prepare some of my supplies here. We'll get my extension tubing, my pre-filled saline syringe. I've opened up both. Need to make sure to maintain a sterile field with this extension tubing here. I'm popping the cap off, placing it in the sterile field, attaching my pre-filled saline syringe, and I'll be flushing the tubing, making sure not to splash anybody, and I'll gently place with the cap back on in this little sterile field I have here with the packaging. Alright, now let me take a look at your arm here. Okay, well, you know what, I'm not seeing too much right now, but maybe if I pop this tourniquet on, I'll be able to see more. Can I have you lift your arm up gently for me? Alright, thank you, sir. Now this is going to be a wee bit tight, but I think we'll be able to make do. Oh, sounds good. That all right there? Oh, yes, sir. All right. Oh, you know what? I found a nice vein right here. Now let me loosen this up for you while I prepare the rest of my supplies. So I'm laying out a Tegaderm patch, alcohol swab, label with gauge of the needle, 22, insertion date 10/7, and my signature. I'm laying out the IV catheter, the needle, gauze, swab, tape, and sterile gloves. Now that I have everything laid out here, I'm going to pull this tourniquet tight again, and I'm going to insert this IV. You ready? Oh, yes, sir. Alright, so I've selected an appropriate vein here. Let me swab you with this alcohol here just to make sure. Oh, that feels real nice. Yes, sir. Now I'm going to use this Chlor Prep swab. Make sure everything's nice and clean here. I'm going to let that dry off there. And while that's drying off, I'll put on these sterile gloves. Sterile gloves, I've ripped them earlier. I've donned my sterile gloves. I'll maintain a sterile field now. So I've opened up my IV needle. I've selected an appropriate vein. Alright, now Mr. Leaf, can I have you take a deep breath in for me? I'll be inserting needle bevel up. Alright, I've received flashback from the blood. I'll insert the catheter forward while withdrawing the needle and activating the safety mechanism. I will hold it in place, firmly applying pressure to the side of the catheter, and I will place sterile tape over the edge of this catheter here. I'm going to press down with gauze and connect the extension tubing. I will flush the extension tubing, pull back to ensure blood flow, I will lock the saline, remove the saline tubing, and place down my tape to ensure this tubing stays in place. And I'll apply the Tegaderm patch. Now I'm going to place the Tegaderm patch to ensure that the entirety of the side of the catheter is covered. It's nice and flush. Now that isn't going anywhere. Let me remove this tourniquet here. Oh, I bet that feels much better, doesn't it? Now I'll secure this just a little bit more. Can't have that flopping around now, can we? I'm placing my label over some tape, and I will clean up the environment and make note of this in the chart. And I'm sure Mr. Leaf, the doctor, will be back to see you shortly. Is there anything else that I can do for you? No? Oh, wonderful. Oh, you think I did a great job? Thank you, sir. Thank you.